many births do you actually have to go through or witness or assist with before you are able to go and do your own thing?
So it's about 70 births that you have to perform within different phases. Like you have your assist phase and your primary phase and your observation phase. But it's about 70 total births that you need to become a midwife.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr-Frank.
Shatamia Webb is a licensed midwife and has been part of the Lafayette birth community since 2012 and has also been certified nationally since 2017. Miss Webb was born and raised in Lafayette and is a wife and proud mother of 2 sons who were both delivered by midwives. She obtained a bachelor's degree in biology from McNeese State University and an associate's degree in midwifery from SLCC. She is the owner of Baby Catcher Birth Center, which is the first Black-owned freestanding birth center in the state of Louisiana. Ms. Webb is an alumnus of Leadership Lafayette, Class 36, and was named one of Acadiana's top 20 under 40. She is also a member of the Junior League of Lafayette. Welcome.
Thank you.
Welcome, Ms. Webb.
Thank you for having me.
Thank you for being a part of the podcast today. Tell us about your journey and what really inspired you to become a midwife.
So my journey started in 2012. So I've always wanted to be a doctor. That was, what do you want to be when you grow up? And that's what I wanted to be. So I took a different route after undergrad. I came back home, just started working at a petroleum lab in the area. And then I found out about a midwifery program. So I enrolled a few weeks before my wedding.
A few weeks before your wedding?
Yes.
Okay.
And I enrolled, and I didn't even know what a midwife was. So I don't have a history of having midwives in my family, but now I do. So I was enrolled in school, didn't even know what a midwife was. And about 3 months into school, I'm like, oh, so this is what this is. So that's kind of how my journey got started. I didn't even know what I was stepping into, but here I am.
A leap of faith.
Yeah.
A leap of faith.
Yeah.
So what kind of training and experience really do you feel shaped your approach to midwifery?
So training was 2.5 years in school and then 3.5 years in a clinical setting. So it was following another midwife in the birth center. It was Lynette Robinson. She was my preceptor. And
she's very well known.
Yes, she is.
Where is she located?
She's in Lafayette also.
Okay, so...
She's retired now.
Oh.
Yes, but she was my preceptor throughout. My clinical setting started at a birth center with General Choices. It was the first freestanding birth center in Louisiana. And then we transitioned into just a home birth practice. So that's where I finished off all of my clinical births with her.
Wow.
Yeah.
And can you describe for our audience the difference between a midwife and a doula?
Yes.
A lot of people, whenever we talk about that, we do see a lot of expectant mothers here at Carr Chiropractic. But I think a lot of people need some clarification on the differences between those two.
So a midwife does all of the clinical things, all of the quote-unquote medical things. So we're actually catching the baby. We're doing the labs, doing the blood draws, doing the ultrasound referrals. So we're walking them throughout pregnancy from the beginning to the end, postpartum care, prenatal care. A doula doesn't do anything medical. So she's not doing your blood pressure. She's not listening to your baby. She's not catching the baby. It's more of your advocate. It's your support person. It's doing a few prenatal visits, going over your nutrition with you, and also being like the biggest advocate for you, especially in a hospital setting. So she's your voice and your reminder, and you're giving your partner a break if they need a break. And she'll also do postpartum visits, but it's nothing clinical when it comes to a doula. So it's more your support person.
Okay, I learned something new. I mean, I knew there was a big difference, but I think it would help if people would know and have some clarification there. So do you utilize the services of a doula?
Yes, so we have a table full of resources at the birth center, and I do refer to doulas. Especially my first-time moms, I find that they do a lot better whenever they have a doula with them. Just because you just don't know, even though we go through a lot during our prenatal care, they just don't know what to expect. Yeah.
How many doulas are there in Lafayette?
There are a lot of
To guess.
doulas, yes. They might not be out in the open, but there are a lot of doulas in Lafayette.
Okay. And how is midwifery care accessible in our community? And what are some of the barriers that people face when trying to work with or find a midwife? I know things are changing. Things are changing, but in Louisiana, some things change very slowly. So what have you seen since 2012 in your entire process getting into this?
A big change since 2012. It is growing. There are also midwives in the hospitals now. So it has been a big change and a big growth lately, especially with COVID. COVID was my busiest year that I had. Just because of the restrictions that they had at the hospital, and people just couldn't bring their family. So a lot of people chose to have their babies at home. So that was one of my biggest years, the COVID year of 2020. And I was pregnant. So,
oh my
I
gosh.
was pregnant with my second
Fun
baby.
stuff.
Yeah.
Oh my gosh, that's a challenge.
Yes. But. So it is growing. Some of the barriers that we face, it's always the rules and regulations that we might face of things that we can and can't do in our state. But we are pretty accessible. We have a lot of home birth midwives in Lafayette. We also have another birth center in Lafayette. So it is accessible, but I still think that not a lot of people know what we do and the care that we provide. Recently I had someone that came and toured, and she walked in and she's like, well, I thought this was just a 3D ultrasound place. I'm like, no, it's a lot more than that.
Yes.
So we do provide the prenatal care, the actual birth at the birth center, and the postpartum care also.
So how many midwives do you think there are in Lafayette?
In Lafayette, I believe we have 5 or 6 midwives.
Okay.
I know there are 2 for sure at Women's and Children, and 3 at the other birth center, and then 3 practicing home birth midwives, I would say. So about between 5 to 8 midwives in Lafayette.
So they are now in the hospitals, because in my years of practicing, I know that wasn't always a thing. What do you think changed? Do you think it was a demand from the public?
I think so, yes. I think it was a demand from the public. I think it's just a different type of care. It's more intimate, it's personalized, it's not a standard way of doing things when it comes to pregnancy and birth. So yes.
Choices, options,
Yes.
that's what
Yes.
people like to have. So do you collaborate with wellness practitioners? I'm sure you do, work with lactation consultants,
Yes.
chiropractors, OBGYNs.
Yes.
What has your experience been working with these people in our community?
It's been great. I've had instances or births where I had to call out a chiropractor to come and adjust mom in labor at our house.
I love that.
Yes. Also, lactation consultants whenever moms need help with breastfeeding, and it's just beyond what I can offer. Also, even just OBs. So we do have a medical director that we work with who I can consult with, and we can transport to if we need to. So we do have good relationships. Also pediatricians that we refer out to also. So we have good relationships with different resources in our area.
A good teamwork. I mean,
Yes.
you can't do it all.
Need a village.
Yes, you do. Absolutely. And how do you support not only the physical, because of course we know about labor, those of us who have become mothers ourselves physically, how do you support them not only just physically, but also the emotional and the mental well-being of your clients? How has that affected your practice?
Yeah, it's a big challenge and task sometimes. I was telling a client yesterday that I had 17 different people that texted me the other day. Not spam, they were actual people.
Okay.
Whether we're friends or family or clients, and I just needed a minute.
Yes.
But it's,
Downtime
yes,
is very important.
Yes, I've learned that you can't treat everybody the same. Everybody has their own personal things that they're going through. I might have one client that's just going through a lot that walks in, so I have to turn that switch on and be that mental health counselor sometimes. Or I have 30 minutes later another client who's high strung and we're all bubbly. So it's an adjustment that you have to adjust yourself to, and not just treat everybody the same. Everyone is going to need something different from you.
Sure. You wear many hats.
Yes.
And how does that affect you
I
with your home life or going home? Like,
yeah.
How does that affect your mental and
Yes,
emotional
because
well-being?
I take work home. I can't just separate the two. I'm always doing something. So I try not to let it affect me. I try to take my personal time whenever I need to.
Good.
Things that I look forward to is once a year, I take a weekend to myself. I
Good.
book a hotel in the area, and I just do my own thing.
You get
by
away.
myself. Yes.
Everybody needs
Yes.
that away time, whether it's just reading a book or going to the park and just having peace and quiet to yourself.
Yes.
That's really healthy as well. So what do you find that are some of the biggest misconceptions about what you do? And would you like to clear it up for our listeners today? Because I'm sure there are several, but pick some of the top few that really people aren't really aware of.
The biggest misconception is that we are not trained. We don't know what we're doing. We're not licensed, but we are licensed. I've been licensed. I think next week will be 8 years since I've been licensed.
Good.
It took some time to become a midwife. It was long days and long nights and missing holidays and birthdays and special events. So I think the biggest misconception is that we don't
Education.
know what we're doing. Yes. Just because I don't have a nursing background doesn't mean that I'm not skilled and trained to do what I'm doing.
And capable.
Yeah. I think that we all choose our path of what we want to do. And there are two different types of midwives. There's nurse midwife and a CPM. And I believe that just because like I said, I decided not to have a nursing background doesn't mean that I'm less than anyone else. But the things that we do offer, so we do all the prenatal care. We do require them to see a doctor at the beginning of pregnancy to confirm pregnancy, to confirm that they are low risk, because we can only manage low risk patients. So we do all of their prenatal care. We can do blood work in-house. We refer out for ultrasounds. Like I said, we collaborate with a physician if we need to transport them back into care at any point or any complications that might come up during pregnancy. We're doing a lot of educating. That's something that they might not be getting with their physician. So our visits are longer. They're about 30 to 45 minutes long. Like I said, it's educating, it's breastfeeding. It's
Yes, I'm sure people appreciate that time that's taken.
It's talking about the different complications that might come up in breastfeeding. We talk about what to expect with baby's diapers, how to store breast milk, the different positionings with latching. We talk about labor, the different stages of labor, what early labor looks like, what active labor looks like, and then the postpartum period. So we're talking about making sure they have the help that they need after they've had their baby and they're not doing too much at home.
Sure. And the emotional aspect of that as well.
After they've had their baby, they usually stay about 3 to 4 hours at the birth center, whether it's at the birth center or a home birth. I make sure that they're breastfeeding fine, they're comfortable with breastfeeding, they've passed their urine, they've eaten something, and their bleeding is under control before they go home. And then we also carry like medications also. So we do carry Pitocin and Methergin for hemorrhaging. So we try to start off as natural as possible where we do carry those things. We carry oxygen tank for resuscitation, IV fluid, antibiotics for different things that might come up in pregnancy. And then we do a postpartum visit at their house the very next day. So we do a day 1, day 3, and day 7 at their house, and then they would come to the office at 2 weeks and 6 weeks. So we're seeing them 5 times in that postpartum period.
How big is your team over there? That sounds like a lot of stuff. A lot.
It's stuff that I was trained to do, so it just became routine for me to do. So it's not out of the ordinary for me to do home visits after they've had their baby. Yes, I might be tired from a long labor, but I know they need that care after, especially a first-time mom.
Sure. And so you might get a call at 3 a.m.?
Yes.
It's time for baby.
It's time, yeah.
Okay.
But we talk about that during their pregnancy of when to call, the signs of labor, what might be coming out, what they need to look out for, so they know.
First-time moms.
Yeah.
I mean, it's so unexpected,
Yes.
everything. You can read, but until you go through it, it's so wonderful that y'all have that support there that everyone needs, especially during that very precious time.
Yes. We also talk about what happens if their water breaks. So it's not the big gush of blood and you run to the hospital.
Panic, yeah.
Yes. So we talk about the signs to look out for, like checking your temperature, making sure baby's still moving good, the color of the fluid. So we talk all about that so they know the different things of what's actually happening throughout their pregnancy and labor.
That's wonderful. I'm learning. I did not know about blood work done in-house, so
Yes.
that is wonderful to know. And from your perspective as a midwife, how can midwifery help bridge the gap and provide more culturally responsive care for women of color? Because I know you said you're the first
Yes.
Black-owned freestanding birth center. That is
Thank you.
wonderful. That is wonderful.
Thank
Making
you.
some changes out there.
Yes. So when I opened the birth center, it wasn't to get all the accolades and the recognition. It was because I was doing home births. I was traveling an hour and a half away from Lafayette in all directions. So Alexandria, Baton Rouge, Morgan City, Lake Charles. And it was a lot of wear and tear.
That's
so
a
that
lot.
2020 year really clicked something. And I'm like, I can't keep doing this all the time. So that's why I opened the birth center. So it wasn't for the recognition. I didn't think it was going to be as big as it is with the recognition. Like, I'm just a little girl at heart.
Making changes.
Yeah.
No, you got to
Yeah.
give yourself that credit. That's wonderful. I mean, you must have been in high demand if you were driving to all these other cities
Yes.
right around this area. So
Yes.
yes, the demand was there.
Yes, it was.
The accolades just follow when you do something that you're passionate about,
Yes.
which it sounds like you are.
So the change, yes, it's a great change, and I'm fortunate to be able to have this for people. Recently, I had a client that came to me from Mississippi, first baby, so she drove 3.5 hours each visit.
Really?
We just had our last visit yesterday at 7 weeks. She had her baby at the birth center, and she did everything great. Her biggest thing was she couldn't find a provider that was close to her that offered the services that we offer, and someone that looks like her.
Oh my gosh.
So that
True.
is so that is something that is going to stick with me for a while, and that's why I continue to do what I do. Because it's not easy to keep the birth center open. It's a lot of legalities that we go through, but that is one of the reasons why I choose to have it open and keep it open.
Do you find that I don't want to use the word harassment, but constant regulations and red tape and hoops to jump through?
It is. It's a lot of hoops and regulations that we have to follow that sometimes it's frustrating because they just don't understand what we do. And it's like, just come and see.
Check it out.
Yeah.
Spend some time with us.
Yeah.
Ask the questions and learn something,
yes.
maybe. So if someone is considering working with a midwife, what should they be looking for or asking about in a good provider? Whether that's someone listening from Houston or New Orleans or another area or Mississippi, what could they look for in those providers to know that they are being cared for the best way possible?
Being someone that's respectful of their wishes. Like I said, you can't treat everybody the same. I get a lot of, I understand that people want someone that's relatable to them. Like the client I just mentioned from Mississippi, she wanted a Black midwife, and sometimes it's hard for me to comprehend that sometimes, because it shouldn't be about color all the time. It should be someone that's respectful of you.
And capable,
Yeah, it's free to treat people well. So it's like, why do you have to search so far to find someone that is going to treat you right throughout your pregnancy and your birthing journey? So I lost my train of thought. But,
Just wondering, like, what should people in the area or listening in other areas look for in a good provider? Is there a certain degree? Is there a certain amount of hours under another, like you said, Miss Robinson?
Right, right. So someone that's trained, someone that is licensed, someone that is has experience under their belt, that's important also.
How many births do you actually have to go through or witness or assist with before you are able to go and do your own thing?
So it's about 70 births that you have to perform within different phases. Like you have your assist phase and your primary phase and your observation phase. But it's about 70 total births that you need to become a midwife. The particular midwife that I am, you have hundreds of prenatal visits that you have to document and postpartum visits and skills. It's about 50 pages of skill checkoffs that you have to go through also. So it's not a little quick thing that you can just get through.
I wouldn't imagine. And how many births do you do in I don't want to say an average year, because I know you said COVID was very different than
in a
usual.
month, I would say I try to keep it around 2 to 3 in a month, just so that I continue to have a life. And because babies come whenever they want, sometimes people back into each other. But I will say I'm pretty busy in August and September, just because I have repeat clients sometimes. Sometimes it's hard for me to say no, just because I know people want the service. But I try to keep it about 2 to 3 in a month.
Okay. And could you share with us some of the essential things that you wish every expectant parent knew about either what you do or the birthing process?
I wish people knew that it is personalized. It is catered to you. Like I said, I don't treat everybody the same. I treat people like I would want to be treated, with respect and listening and sharing space with them, holding space with them. Because I don't believe that pregnancy and birth is a clinical event. It's a sacred event. It's a time that people will never forget. So it's like, which side of their history do you want to be on? Do you want to be on the positive side of their story or the negative side of their story? Right. So that's why I really take to heart each person that comes to me. I really try to build a relationship with them so that when we have to make those hard decisions, we trust each other to make those decisions together.
Sure. And it's such a, like I said, it's such a crucial time. So could you share a birth story with us? Something that really moved you or taught you something powerful about what you do, or that's something you'll never forget, something that stands out?
I have a few stories. I would say most recently is my mom from Mississippi. Like, that really moved me that she came to me, of all people. Like, you passed up midwives to come to me.
On your way.
Yeah. That is a story that I'm proud to tell, and I'll never forget that. We actually just did a documentary yesterday at the birth center, and she was there for her postpartum care, and she spoke about it. Another story, I had an 18-year-old that came. Her mom had home births, so she wanted to continue on that journey. So she was my youngest client that I've ever had, and she was amazing.
How did that make you feel, working with someone at that age?
That was an amazing feeling, just because I know at 18, I would have never thought to have a baby out of a hospital. Or with a midwife. Like, that wasn't even...
But she was exposed to it.
She was.
With her mother.
Yeah, she was. And I'm glad that I get to expose my boys to that, too.
Sure.
Yes.
I was going to ask you, how do you balance being a mom of 2 boys and getting phone calls at 3 a.m.? There's a baby
village,
on the way.
A great husband that is understanding.
What's his name?
Marcus.
Marcus, you're a good man.
Yes. And he knows all the language now. He's like, well, how many centimeters is she?
He's learned
It's
a lot,
really
I
time
bet.
to go.
Right.
But yes, it's birth happens at any day, any time, whether you're in the car or... I remember we had a birth and it was date night. We're at the escape room, so I had to leave that early to go to a birth.
Oh my gosh.
It was a quick one, so we continued our date night after that.
You did.
Yes.
That's great.
But it's having family that is supportive of what you're doing and can help out whenever you need. And then another story was during a hurricane, and her family decided to evacuate just because we decided to. And we went to Texarkana. She ended up going into labor on the car ride there. She came just in case. And the just in case happened, and we had a baby in a hotel. So
my. So you gotta
babies come when they
be on your toes.
Yes.
There's no time to
stories.
really plan, right, or think about it. So,
yes.
And what do you think is one of the most challenging experiences as a midwife that has begun to shape your practice? Is there something that really said, okay, I need to change direction, or I'm on the right path?
Honestly, I think it's all of the legalities that we face and we have to jump through, especially even with opening up the birth center. So before I opened, there was no licensure with the state, so anyone can open a birth center.
Really?
And then
That's interesting.
into it, we have licensure now. We're accredited now, like nationally, and it's still a constant barrier and challenges. So I think that is something that is still a challenge for me.
Sounds a little bit like chiropractic.
Yeah.
There's always challenges.
Yeah,
but-
I'm still like, well, I should just close it and go back to home births. But then I have people from Mississippi that come to me, and I'm like, well, I can't do it now. So.
Well, yeah, that speaks so highly of you and what you've brought to these families, but also to Lafayette. So, what self-care do you personally utilize since you have to be so supportive and strong for everyone else? Your husband, your kids, your clients, on both an emotional and a physical level. Is there some outlet that you like to use?
So it's that one weekend I do a year to myself. Like, I enjoy it so much. It's showers. It's
True mom here.
Yeah.
True mom.
It's hiding in my closet sometimes.
Close the door.
And then once a year we do a girls trip. So that's in 2 weeks.
Oh,
So,
fun.
yes.
Can you tell us where y'all are
Miami.
going? Miami.
Yes.
Okay. Watch out,
Once
Miami.
a year we go somewhere different.
Oh, that's wonderful. That's good to hear. So, and I wanted to know if your clinic ever holds any kind of open houses or events that people like, okay, I'm really interested, but my family has never been involved with this. I really don't know enough about it to make a solid decision. How can they learn more?
Yes, so we do have open houses or meet and greets. I was actually supposed to have one last month, but I just got so busy.
That's a
so
good thing.
I can plan to schedule one in either next month or August. I can do that.
Okay. Well, you need to let us know how we can attend or how we can find you.
Yep.
Last question. How do you maintain your posture while pursuing your purpose in life?
Giving myself grace. I know that just taking breaks whenever I need to. Last September to January, I had a big break with no births. So I could actually put my phone on Do Not Disturb for the first time in probably 10 years.
Wow.
So
Busy lady.
Yes. I always have something going on.
Again, that speaks very highly of you.
Yes. And then just hearing my clients speak about me, that's something that I never get used to. It's kind of cringe a little bit just because you don't want to hear about yourself all the time. But that really gives me my purpose and knowing that I'm doing what I'm supposed to be doing. I think midwifery is a calling. It's not really a job for me because it's something that I love to do.
Well, there couldn't be a better reason, right?
Yeah.
Well, thank you so much for being
You're
here. I've
welcome.
learned so much, and I've enjoyed sitting down and talking with you.
Yeah,
So
thank you for having me.
until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.